Good morning, and thank you for joining us. I'm Heather Longsminty, and I'm Respond's Director of Philanthropy and Engagement. And today I'm joined by three of my fellow members of Team Respond to provide an update on how Respond has been managing the COVID-19 crisis 6 months on. So why don't we start with some introductions? Jessica, why don't you start?
I'm Jessica Braden, and I'm the CEO of Respond.
I'm Darcy DeLuca. I'm the Director of Finance and Administration.
Victoria Hellberg. I'm the Director of Programs and Services.
Yes, you are. Congratulations. We're really excited to have Victoria join us in this new role as the Director of Programs and Services. Victoria is a 14-year veteran with Respond. We'd also like to offer our congratulations to other members of Team Respond, which includes Jennifer Walter, who's helped Victoria lead our effort during this crisis. Jennifer is now Respond's Manager of Community-Based Programs. And as you can see, Respond has not slowed down due to COVID-19. We're adapting. We also hired our first staff member completely remotely, our emergency shelter coordinator, Nabiyu Sandy.
I'm so excited to have Nabiyu join our team. He has several years experience working in residential programs and doing direct care work, providing services to adults with developmental disabilities, and also has worked with people who have experienced domestic violence as well. So I'm really excited to have him running our emergency shelter program.
Let's take a moment to welcome everyone in their new roles. Yay! Congratulations, Victoria.
Thank you so much.
So we all sat down together way back in March, if you could remember back then. That was within days of the stay-at-home order first being put in place here in Massachusetts. And back then, our biggest concern for survivors at the time was the isolation that's required to mitigate the spread of COVID-19. So can you share a little bit with us again about why this is such a danger to those experiencing domestic violence?
I think for our clients, the one time that they maybe had the opportunity to call us was when they went to work or their abusive partner went to work, and now they're trapped in the house together and don't have those opportunities anymore, so they can't reach out for help. Also, some of the supports that they had in place, maybe family members or friends, also aren't accessible anymore.
Isolation is the key to victimization. If you can get somebody away from their people, and their people can be their workmates, their college friends, their family, everybody's circle is different, you have a greater chance to victimize them, and you eliminate the opportunity for somebody to say, how are you doing? How can I help? I'm concerned for you.
So as we've all seen on the news throughout this crisis, congregate living makes social distancing incredibly difficult when you have multiple families that are sharing common spaces like kitchens and bathrooms. But the cornerstone of our work for the past 46 years has been our residential services program. So can you tell me a little bit about how Respond has adapted to keep staff and clients safe?
Sure. So when we first recognized that we had to do something drastically different at Respond, it was March 13th, Friday, March 13th. I remember it very clearly. And Victoria and the team, Programs and Services team, and I sat down and we decided to alter our staffing pattern so that we didn't have as many staff coming in and out of the house. And we were able to keep that up through mid-April, towards the end of April. And then we recognized, as more science and knowledge about coronavirus came out, that keeping 8 families in a single family home, which means up to 21 people plus staff, with 1 kitchen, 1 living room, 1 dining area, was really putting people at risk. So we decided to move folks into single occupancy units, and we really scoured the city to find something that would be appropriate for them. Moving people out of our shelter was not a decision that came lightly. We really agonized over it. We made that step And we're really happy that we did. Since we have moved folks, there have been 0 incidences of testing positive. We've been able to keep our staff safe and our clients safe.
So we're now 6 months on, and some things have started to open up here in the greater Boston area slowly, but much is still the same like it was when things first shut down. So can we talk a little bit about what are the needs of survivors of domestic violence? How have those changed when things first started in March and where we are today in September?
So we've definitely seen a decrease in our hotline calls, and we've seen an uptick in calls for housing and shelter. Prior to COVID, housing and shelter was an unmet need for many in Massachusetts, and now it's just, even affecting more people. Domestic violence is often one of the leading causes of homelessness. And so in order to meet this need, we decided to redirect our services to where the need was the greatest.
That wasn't an easy decision for us to make. We really had to kind of look at the data and look at what the community needs and see what organizations are providing what services, our partner organizations and other nonprofits in the community, what we can do that is unique in not being offered in the community, and come up with a new plan and create a pivot. And that pivot was to decrease our hotline hours so that we could refocus the efforts of the staff to support our scattered site housing, so our shelter folks who we moved into the community. And it was a tough call. When you are changing a service that has been being provided by the agency for 40 plus years, you didn't do that willy-nilly. We really kind of talked to other organizations who are making changes to their service offerings. We looked at what was available into the community. We looked at what technology we had to make that easier for the clients. And so what we came up with was a new model where our support line will be answered from 8 a.m. to 8 p.m. And I'll let Darcy talk a little bit about that data. That was really a core component of us making this decision.
So what we did was try to take a look at that period of time, the March through July data of what had transpired last year on our hotline and what had transpired this year on our hotline. And what we saw was that there was about a 40% decrease in the calls at all and 130% increase. I'll say that again because that is pretty shocking. 130% increase in the calls looking for shelter or people looking to get out of their current housing situation, which I think plays directly into the pieces of isolation that Jessica and Victoria talked about earlier, is that people are really calling in a critical state now. And so we really wanted to look at the data and say, when are they calling? What do they need? And how can we better provide that?
So with that, we decided to retrain and redeploy our staff to be able to support the folks in the community. And when a hotline caller or somebody who does need our service calls after hours, they can press 1 to be transferred to the statewide hotline Safe Link or to the national hotline as well. So there is a continuation of services, and they can, if they want to work directly with Respond, call back between Monday and Friday, 8 a.m. to 8 p.m.
And for our residential clients, we'll be able to spend more time with them, focusing on their individual needs, helping people navigate the new COVID world that we live in, helping kids get enrolled into schools and connecting people with the technology that we need, and just being able to be a support to people. It is a hard time, and especially for, people that have just recently left an abusive relationship and to come into shelter. They now have, a staff person who can just come and spend a couple of hours with them and have a coffee or fill out some job applications. So I'm really excited to have the opportunity to do that.
I think it's important to recognize, I have 25 years plus experience leading domestic violence organizations and residential organizations. Victoria is equal. Darcy and Heather have also been in the nonprofit world for decades. And there is no playbook for this. every decision that we've made has been really thoughtful, but without it has tested us to make those decisions without having past experience. I mean, for me as a leader, that's been the most dangerous piece. I have always looked at all three of my colleagues and said, in my experience, this, but let's try it or whatnot. And it has been a comfort to me to know I've kind of been around that block a little bit. This is all new for us. So we're constantly testing each other, asking questions, going back and forth. And so far, so good. The clients are healthy, safe, they're being served, we're trying innovative things, and we're making sure that any service we discontinue, there is a place to get it in the community that's accessible and safe.
So our support line, once again, so that's 617-623-5900. The number is still the same. You can now call Monday through Friday, 8 a.m. to 8 p.m. And now, who should be calling this number? Who should be calling our support line?
Anyone who's called our hotline in the past is welcome to call our support line. People who are experiencing domestic violence, people who are concerned for a loved one, our community partners, people looking for resources and other referrals are still, welcome and encouraged to call.
Darcy, do you want to tell us a little bit more about the technology behind the support line? So I know Jessica mentioned that you can kind of, when you dial in outside of those hours, what happens?
That's a great question. What happens is we have the technology set up so they will be greeted by a voicemail message that is in both English and Spanish, alerting them to the new support line hours, which is the Monday through Friday, 8 a.m. to 8 p.m. And then they are given the option to press 1 to be connected to our statewide domestic violence hotline, or the option 2 to be connected to the national domestic violence hotline. And they can do that without ever having to write down another phone number. They don't have to hang up. It is as seamless as possible. They just have to press one more number, and then they can be connected to 24-hour resources.
Pretty amazing. I think we all were impressed and definitely tried calling the support line, the first night it went down at 8 o'clock. Wow, it works. This is amazing, Darcy.
I think our foremothers would be flabbergasted at where we are today. Anything else you'd like to add or mention while we're here?
I want to do a big shout out to the Respond community. It is well known, anybody who's watched these videos or listened to me talk, we raise about 50% of our budget every year. And we're faced with trying to raise 50% of our budget in a time of what's going to be a significant economic decline. And people are showing up, they're helping, they're giving, they're volunteering. The notes from folks that I've received, I used to get services there. Please keep up the good work. It's been as difficult as it has been amazing. And those words of encouragement and those votes of confidence have really kept all of us going. So thank you, Respond community.
I second that. Thank you so much.
Thank you very much.
I know we've all been so touched when we receive a package of masks or toilet paper or hand sanitizer. They all mean so, so much to all of us. So I'd like to thank all of you for tuning in. Don't hesitate to call our support line if you need help, 617-623-5900. And for more information, visit our website at respondinc.org.